Healthcare expenses are the number 2 cause of bankruptcy in Wisconsin and in America. That's not right? I mean, so that it just doesn't feel good. Most of us went into healthcare because we want to help people, and we still get the opportunity to do that. But if I help you and then you're bankrupt, did I help you? I don't think so. My name's Josh Johnston. I'm an anesthesiologist. I'm one of the co-founders of Renovo Health. And so I'm one of the guys that if you're here for a procedure, will help you undergo that procedure in a safe manner and usually be unaware of it. The typical savings that you would get with us is about 50%. I would say our costs vary anywhere from 40 to 70% of legacy system or elsewhere. Usually we're more around 50%. Renovo Health really grew out of frustrations that are pretty common in the current health system. And those frustrations for me came both as a patient and as a caregiver. So on both sides of the spectrum, really frustrations with the incredible cost of healthcare. I'm a physician. I feel like I probably can afford a lot of good things, but I still get a bill and it makes you change your plans for how you're going to spend your money, right? I still get a bill and say, well, that can't be right. Because there's no way somebody else that maybe has a less well-paying job can pay that bill. So frustration with the cost is one thing. The other thing is the frustration as a caregiver with not feeling like I'm directed in what I have to do by people who are not caregivers. Feeling like what's most important is that I check the boxes to make sure I can maximally bill this patient. And I'll get lots of feedback if I don't do that. That's really frustrating. So those are basically the two influences. Frustration as a caregiver, not being able to connect and do what I think is right for a patient, and frustration as a care receiver with the cost of care and sometimes feeling like you're a number in a big system. It's an assembly line. So that's a big frustration for people. And again, impetus, like I said, why we exist, trying to break that chain of impersonal, expensive healthcare. And on the caregiver side, it's no fun to practice in that situation. If you think about your typical primary caregiver in the legacy system, they've got a quota they got to meet for how many patients they got to see. Nobody cares actually how they interact with their patient, but if they don't get the right number of people seen, there's going to be a meeting and you're going to be called there. Does that feel good? These people gave up really the best years of their life training to help people, and then they feel like they get put in a box and told you can't care about people, and if you do, we'll punish you. That's what we call moral injury or burnout, etc., but that's super common. So our typical staff is, kind of like me. They've been around long enough to work in many different situations, to have learned about how care is done in different places, to be very confident in the work they do, and they've figured out enough that they want to do it a different way. They want to be part of a solution, not just getting a paycheck in the old system. Start snooping around the website, call us, talk to us, come visit us. Come just stop by and look what's here, because you will be very happy. And it won't be just because the bill is half of what it was before. You'll be very happy because that small business owner is a specialist in treating his customers like a person, right? That's what they do all the time. And you just have the opportunity to be treated like that when you get your health care, which is all you could ask for.